Hey, welcome back to my YouTube channel. So today we are talking about joint rotations and why they should be a part of your warm-up if you have Ehlers Danlos Syndrome. This is, again, not medical advice. This is coming from somebody with experience as a personal trainer who also now has Ehlers Danlos Syndrome. And so with Ehlers Danlos Syndrome, one of the problems is really poor connective tissue, and that can lead to a lot of problems in your joints. So we want to keep our joints as healthy as we possibly can keep them. And one of the things that keeps joints healthy is pain-free movement through a controlled range of motion, especially because it lubricates the joint with synovial fluid, which is what keeps the joint healthy. So I will post some more research on how you can do joint rotations and so forth. You will see those in the video that I did at the beginning of this series, which was kind of an introduction to different things that you could put together, different components of a healthy workout routine for someone with EDS. So you should go back and watch that video. A few caveats. In that video, I do some joint rotations that may be contraindicated for certain people. Ehlers-Danlos syndrome there's similarities between people with EDS and then there are differences. So for example, I did some cervical spine rotations. I'm going to walk you through some reasons why that might not be a good idea for some people and why actually cervical spine rotations side to side are recommended for a lot of people, but that most people do not recommend going back. I can explain to you why I do personally, but that might be contraindicated for you. Also, I did some lumbar spine rotations from the hips, and that honestly was just me in the middle of doing that video forgetting which joint to move. So lumbar spine rotations might not be a good idea because the lumbar spine is a more stable joint. So instead do hip rotations. But everything else and the premise is there. So this is where we get the idea of joint rotations and which joints to rotate. So we know joint rotations can be a good thing. We want to lubricate our joints. Which joints do we rotate? Well, some joints are made for more mobility and some are made for more stability. They're not meant to rotate or move as much. With EDS, you can move almost all joints more than they should. My ribs dislocate. Those are not supposed to move out of place. My sternoclavicular joint dislocated. That's not supposed to move. That's supposed to be one of the most stable joints in the body. So it's important to know which joints are meant to move more and which ones are meant to be stable, because just from your body, you might not know that. And you want to be careful. So the neck is one of the more stable joints. It's not meant to do a ton of movement in different directions. So rotating in the neck side to side, maybe forward and back a little bit, but you want to be careful. You don't want to hurt it. So please listen to your body and do what is good for you. For me, it feels good to go back a little bit, keeping that arch in my neck, because my neck can tend to lose that arch pretty easily. But you need to listen to your body. So neck rotations may or may not be a good thing for you. That is one of the more stable joints. The thoracic spine, so this is the cervical spine or the neck. The thoracic spine is meant to be a little more mobile. You're meant to be able to move the top part of your body. A lot of times we use that part of our body for everything from swinging, punching, a lot of activities. So that is meant to be more mobile. So rotating side to side from the top part of your body, the thoracic spine, is totally a good thing if it feels good for you and it can keep your joints mobile in a good way. But remember, range of motion should be controlled, slow, and within a limited range of motion, because you can hyperextend and you want to learn what hyperextension is and how not to do it. So you've got to pay attention to your body, and you might want to meet with a physical therapist or a personal trainer who can help you do that. The lower spine, the lumbar spine, is not supposed to move as much. So that's why when I was doing those rotations in the video, which I won't replicate, but I was moving from up here, you should be moving more from the hips, because the hips are definitely more mobile. That was just me slipping in my brain all the things I was trying to remember in that video, and that's my apologies. So replace the back rotations in the video with hip rotations, because this is the more stable joint this is the more mobile joint. Knees, more stable. We're not going to rotate our knees. You might see some people do that in certain instances. My knee's sublux, I'm not even going to mess with that. They're already hypermobile, leaving that alone. So I'm going to focus on stabilizing, especially the points that are supposed to be more stable. I'm going to move in healthy ranges of motion, but not rotating. And then ankles, more mobile. So again, the places that you see that are supposed to be a little more mobile, those are places that you can do some good hip rotation, you can do some good mobility exercises. So I'm just going to show you a couple of areas. So we've got our hips, we've got our thoracic spine, and we've got our ankles, and also wrists and our shoulders, which are not pictured in this up and down kinetic chain visual for you. So here are a couple exercises that you might try. So wrist rotations, we can go in any direction. Ankle rotations, again, any direction. We want to be slow, we want to be controlled, and we want to practice learning what is good range of motion and what is not good range of motion. Hip rotations, those can be a really good thing. Keep everything in your joints lubricated and moving well. We can do arm circles, slow, controlled, not overextending. So if you have to exaggerate not overextending, hyperextending, then do it. You want to move your joints through a controlled range of motion. So if you're not quite sure what that looks like for you yet, then maybe you go the other way and you keep it even more limited than you think you should keep it, because that's the goal. So give some of these a try. Try to keep those joints as healthy as possible, and remember which joints in your body are supposed to be more mobile, and slow, controlled training of those joints is going to keep them healthier longer. And remember which joints are supposed to be more stable, and you're going to train those joints a little bit, the muscles around those joints, and you're going to care for those joints a little bit differently. And that is all for today.